Hi there. Welcome back or welcome to Recovering Out Loud podcast, the show where we get real about mental health and addiction. I'm so glad you're here. If you or someone you love is struggling with drugs or alcohol, please reach out for help. Send me a message on all social media platforms at Recovering Out Loud Pod or by email at recoveringoutloudpod@gmail.com. You are no longer alone. So that's why I like doing the back and forth, like the professionals, lived experience, back and forth, and then the family side of it. I always love doing because my last relapse, I was really, what's the word? I don't want to say humbled, but I was humbled, but I was really, my eyes opened to how much I affected my family, right? Because they saw. It was different for when I didn't have a solution before, when I was 23 and I had no solution at all. I had no concept of, I didn't even know what that word meant. I just thought everybody used drugs and drank the way I did. And I was going to go on like that for the rest of my life and somehow manage it one day, right? This great illusion that we all have. So this time around, my family knew that I had a solution and I wasn't reaching for it every day. And I was choosing to live in Airbnbs and hotels and do all these crazy things. And so that's my point with that is I'm very interested in, also too, I get a lot of messages from family members, more so than addicts, I would say.
Yeah, family's a complex one. We can get into that a little bit today, or I can try and be helpful to your listeners in terms of my own lived experience there. So, how long have you been sober now?
Now almost 10 months.
Amazing.
Yeah, so I had 8 years.
Okay.
And decided that I had a secret about something. I always talk about it. It's a long story, but essentially I wasn't telling the truth about what was going on over here, and I had these ideas of fixing my body dysmorphia, so I started with performance enhancing drugs and steroids. And every time I say that, it's funny. People are always like, well, how does that lead to, smoking meth? And I'm like, well, dude, like, it always starts with one thing, right? Where you're like, I'm not going to tell you about this thing and then it snowballs into like secrets and secrets and secrets. And then I'm doing Adderall. And then next thing I know, I'm on the couch and someone's offering me to smoke some meth. And I'm like, why not? Fuck it. Right. Why not? And then, it's very hard to get back in at least my situation, but enough about me. People talk about me all the time. I want to hear about you.
Oh,
do they?
Do they? I feel like I'm among
trust me,
big deal here with Anthony.
I could talk about myself
in Recovering Out Loud
all day. Yeah. Thank you. I could talk about myself all day, but thanks
I'm
for
the opposite.
coming.
I don't struggle talking about myself, but I feel like every day it's a journey of coming to peace and acceptance of, my life and experiences. So thank you for giving me the opportunity to come and share a bit today.
Yeah, I'm excited.
It's nice of you.
I gotta say, I absolutely love your passion for this topic.
Oh, thank you.
Within meeting you on the phone, just talking on the phone for 10 minutes there, like I could just feel how much this means to you. And I'm excited to get into that. Like, why is it so important to you, for one? And why don't you tell everyone what you do first?
Okay. I do a lot. I'm a little bit of a workaholic. But I'm making a transition right now away from, or with the Canadian Addiction Treatment Centres. They're a wonderful network of service providers. So always kind of worked in mental health and substance use in some capacity. I would say most of my experience has been through inpatient treatment centers in the private world, but I've also worked in nonprofit and the public sector. So I went from, a private treatment center that was a little bit smaller a number of years ago. And then I moved into nonprofit, and I actually worked in the shelter system for 3.5 years over COVID-19 or throughout COVID-19.
Whoa.
And yeah.
You've seen some shit.
Yeah, definitely seen some shit for sure. It was a devastating time. It's a lot of times I wish I haven't seen the things that I've seen, but at the same time, I'm also grateful that I've gotten to be able to see the reality of how much our system has failed people, and how, just like you were sharing right now, Anthony, like it's the difference of a day for someone, for a lot of people. And there's so much misunderstanding around people who are struggling with substance use, also mixed with like mental health. And then you also add the housing piece, which is becoming more and more of our communities and society. I mean, it's just the numbers are going up and up and up. So even though it was traumatizing working in that area, I'm so grateful. And some of the most amazing people I've met have been like residents of the shelter system, who I just truly think are the most remarkable humans in the world. I really do. I grew up in precariously housing situations, and just had a really rough childhood and didn't come from a lot. So I feel very at home in that environment, ironically, no pun intended. And it's just kind of where I feel really at peace, which is kind of hard to explain. But I loved working there. And then I came over to CATC again about 3.5 years after that, and stepped into some executive leadership or senior leadership there, and just kind of grew within the organization. And now I'm kind of starting a new journey myself. And throughout, the last 1.5 years or so, I started my PhD in psych as well. Wow. But the specialization is industrial and organizational psychology. So it's kind of like thinking about teams and companies and organizations as an individual itself, and working and consulting to help make that whole individual, if you will, be as healthy and effective and, healing as we possibly can. Like I can obviously go into it more if it would be helpful, but that's how I most easily explain it. So just really, really grateful for the career so far.
And that's so
sure.
Specifically when you talk about helping organizations run I like that analogy too, like
a
healthy human.
Yeah.
There's certain things that need to fall in place, daily things that need to happen, right? We can, the metaphors can go on forever. You're talking specifically addiction centers, organizations, or just mental health, or
just everyone, actually.
So like any organization.
Yeah. And what brings me to it is, after years of working with individuals, and Anthony, when I say every type of person, I truly mean every type of person. I mean, if there's a profile people like to put towards substance use or homelessness, I can tell you right now, none of those profiles are accurate. Mm-hmm. There's no face of addiction or face of homelessness or face of mental health. It's just all of us, any of us. And I just think the most prevalent thing coming through, there's probably two. One is trauma, for sure, but the other one is stress. And it's our environments where people go in to work every day more and more, and we just live in the world where, I'm sure you've said it on the podcast many times, like the opposite of addiction is connection. And we are living in such a disconnected world and heading into a place where I just think more and more people are going to be struggling and trying to cope and keep up with the unrealistic demands of the workplace now. And again, just the impact of stress, that we really need support there, or we're just going to keep seeing people struggle more and more.
I mean, I can relate to that 100% more recently, right? Like it is so much, especially living downtown Toronto. It's so funny, right? Living in a huge city with the most people, a lot of people in, I want to say in Canada. Is it most people in Canada? I don't know. There's a lot of people that live in Toronto, but such a big city, you can feel so alone. Like it's so easy, right? And especially being in a condo, it's so much easier for me to just isolate, even, I live with my partner at home, my wife, but it's so much easier for us to isolate than it is just to go out and to see my family. My family's in the GTA, and for me, there's some days where it's like, that's just like the longest trek, right, to get out there.
Absolutely.
And so that's something that I've been struggling with for sure, is like, it's just so much easier to stay at home and not connect with anybody. And sometimes I'll get a phone call and I'm just like, oh, I don't want to, like, it just snowballs, right?
Yeah.
Like it starts with one night in, and then it's like not going to the gym, right?
Mm-hmm.
When you don't go to the gym for a while, it's just so much easier to choose the life of Netflix and chill or whatever,
Yeah.
whatever your vice is.
I also think there's something there you're bringing up, which is that exhaustion and just, oh my gosh, there's something else I have to do in my day, speaks to the fact that we're constantly on our phones and constantly connected to the world in a way that our brains and our bodies literally are not meant to be kind of constantly facing all the time, 24 hours a day. I was speaking at an event last week, and I talked about just the breakdown of the stress cycle, and it like helped me remember that our nervous system, when we go through that stress, we're supposed to, or we did for a very, very long time, close that stress cycle by just returning to a state of rest, relaxing the nervous system. Equilibrium, right? And so now, because our phones are always on, anyone can message you anytime, I need help, or can you help me here? And whatever, come in for this shift, or, whatever it might be. Our poor nervous systems never rest and never get an opportunity to just regulate again. And so we're constantly in this overhaul of like cortisol spikes and constantly going and thinking and moving and doing. And then of course we just crash. Like we're just like, I can't imagine going, across town. I can't have anything else to give. I have nothing else to give to this world. Today, I just want to like Netflix and chill. And so maybe it's a bit of a stretch, but when I think about that and simply connected to the cycle of addiction, it just seems the exact same to me. We're coping, and there aren't enough outlets for us to, get that rest, unpack our mental health, connect with an individual, go and have fun, have a bit of play and joy in our lives. And then as soon as you know it, you're, like you just said, you're the Adderall and you're just like, I'm in it. I'm totally snowballed into it.
Yeah.
Right. So I'm really fascinated with that, Anthony. And I feel like I have a newly called purpose to share that in the workplace where we spend 80 to 90% of our time, and we just don't care for ourselves and others the way that we need to.
What do you think the biggest problem with corporate or workplaces are today? What do you think the biggest issue is?
So I think when it comes to substance use, it's an interesting paradox because on one hand, it's normalized, and it's, after work, let's go and grab a drink, or let's go and whatever. And then it very quickly turns into something that's very stigmatizing. Oh, that person is struggling, like, let's just push them through an HR process and really isolate them, even though they're having a hard time. A lot of the organizational practices are not rooted in any type of like trauma-informed or just social justice or human-centered practices. They're very, very rooted in industrial outcomes and priorities. Yeah. And of course, decades after decades after decades, that's created, even with the best intentions, an environment of distrust and maybe fear sometimes. So in order for us to like heal through that, we have to make I really like talking about upstream solutions. And I'm not trying to place blame there in any way on like, specific departments or leadership necessarily, but I do think upstream solutions need to include all those conversations with all those people on how they can do things better. Like really just looking at the impact of a policy or a process on the person. Here's something, I'm already rambling. I knew this was going to happen, but mergers and acquisitions are fascinating to me. They happen more and more. It's like the highest time for mergers and acquisitions. And I read a stat like a year ago that said 70% of mergers and acquisitions are like fail. They don't really ever get to a point of maximum profit and success. And it really started getting me to think about like when in the merger and acquisition process do the people get thought about? Like when we're making all these changes around someone's livelihood, fear of restructuring, it's a world economy. Like there's so many fears. When during that process are people addressing those fears and creating space to prevent and not create harm to people. So that example alone, which again is a normal organizational experience and action, or however you want to call it, all those people, the ripple effect is all of those people then have to go through that stress, putting all of those people at risk for a number of different mental health or substance use challenges. When I was at this event last week, I identified some of the high risks in an organization, and it's all really similar to, again, on an individual basis. So things like, staff being isolated if you're shift work, or out in, parts of Canada like mining or drilling, massive rates of substance use, opiates, physical pain, trauma and adverse impact, critical incidents on site, massive change. Change is a big one. Those are like 4 or 5 things that happen all the time that we know tons of information on, yet we're not embedding them into our practices, our organizational practices. So yeah, my hope is I can maybe help in that way, especially for the industries that have those higher risk factors, which at this point is almost every single industry.
Yeah. Construction and trades being probably the leading.
Yeah.
I would say I've actually done research on this because it interests me as well. I think
You're spot on,
I don't
Anthony.
have the numbers, but I think bartending and service industry is like second, I would say, and then something like professional, lawyers and stuff like that would probably be up there. Doctors as well in some scenarios.
I think it's something that we need to look at. I'm really happy you brought up the trades and construction, because one of the I work with a lot of referents in that space, or worked with CETC. They do amazing work.
Yeah, they have a lot of good unions, right? That cover treatment.
Yeah, exactly. But at the same time, when people who are in the field need to start doing things that people in the field do, that's scary to me. So I'll break that down. If in a workplace you have to start training your staff on how to do overdose prevention or to use naloxone, that is a really downstream solution. What is it upstream that's creating the situation of someone coming to work, using opiates or a substance, using to the extent where they're putting themselves at risk and at harm, or in harm's way, and then it's people around them that have to potentially save their life
and go through that trauma.
It
also, to me,
that's wild to me.
It also
Anthony.
it tells me that they're kind of just saying, well, work has nothing to do with the reason that he's using drugs. He's just fucked up at home, or he's got a lot going on. That's why it's like, you're at work 8 hours a day, right?
That's exactly it.
Majority of your day.
That's exactly where the passion comes from, because that mentality is so incorrect and so damaging. And that's part of the problem. We can't pretend people are still peopling or people while they're at work 8 hours a day. And it's not to say that we need to go as far as, I think people think, well, like, how do we then even manage that? What is the answer? And I don't know if there is just one answer at this point, because it's not even something we're talking about that much. We need to be talking about it a lot more.
I can provide an anecdote to that, because this happened to me. So after I got sober again, I left my corporate job that I was there for 8 or 9 years. Didn't get fired, actually, surprisingly. I managed to leave and go to another job.
Probably because you're really good at what you do.
Yeah, I mean, in recovery, I built like a good life, right? I built a lot of good skills and tools, and I was good at it. I didn't like it, right? I didn't like what I was doing, which is why I pivoted into this industry now. But I got a message after I started posting on social media a lot from a guy I used to work with. And he just, this huge long thing, man, I'm so happy you're doing well. And I'm thinking he's going to, I'm going to say, I had no clue, like, holy fuck, this is like, what? Right? Because that's what we think, that no one knows, right? That we're going through shit. He goes on to say, I really knew you were in a rough place. I knew you were struggling. And I didn't say anything because I was told not to by people at work, right? And I just looked at that and I was like, that's so messed up. Like, You know, there's got to be, to your point, there's got to be something better than, you know, oh, that guy's messed up. Let's talk about him and how bad he's doing. But, you know, what are we going to do? We can't do anything about it.
Yeah.
Right.
And I mean, it's okay to say, what are we going to do? We need help.
Yeah.
I mean, I know it's hard to ask for help. I can relate to that. But if we start asking for help just a little bit more, people like me and many others who, you know, would have my experience or education or better can come in and help. Like, that's the whole point, is let's start to have these conversations and figure out how we can help people. Because yeah, it's just scary to me that, you know, and the ripple effect, Anthony, is huge. And what I love to do, I love a hard conversation. Like, I love problem solving and finding a way for everyone to have a win-win-win. So I believe, you know, there's a way to do this where we help people, number one, we create healthier workplaces, number two, and companies are not spending unnecessary money or having accidents or, you know, toxicity or just expenses that are incurred as a result of not having these conversations. I really believe by having them, everybody wins at the end of the day. Like, it's just the right thing to do. Yeah.
And I mean, I'm just thinking about how that would play out. Right. And I agree with you 100%. Maybe we'll never have a good answer for it. Right. But to your point, it's like, I just think about how my family helped me. Right. And because they had no idea what they were doing too. I mean, at least if we took someone aside, it's really hard though, right, to do that in a professional setting.
It's hard if we make it hard, not to cut you off, but it really is hard if we keep saying it's hard. I mean, you and I just met. This isn't hard. We're just people. We're just being people together. We're just chatting. You know, I'm coming to the conversation with no judgment and support and, you know, just the priority of like showing up for you. That's not hard for me to do. I don't think it's hard for you to do for people who get the honor of coming and chatting with you. Like, it can be hard. It can be complicated, but I do wonder if it needs to be hard and complicated. Yeah,
it's true. I mean, I think there's just a stigma around the workplace that we can't talk about this stuff, right? I can't approach said individual. What if I'm wrong? There's all these things that are going through my head, right? And chances are you're not wrong. If you're noticing some behaviors, right? The chances are they are struggling with something. So I mean, it could be as simple as like, hey, is there anything I can do to help you, right?
Exactly.
Is there anything that I could do? It looks like you're going through a tough time, right? Maybe I'm wrong, but yeah, it's not that complicated.
It's not that complicated. And complicating it and that's part of the stigma. Like, that's part of the fear and the avoidance of, I just, like, this is too big, too messy, too unfamiliar and confusing for me to step into the space. And what we're doing there is, you know, again, well-intended. Like, I know we're not, you know, wanting to hurt someone as a result of that, but by continuing that narrative and that language, we're continuing to stigmatize it. Again, at the end of the day, I teach trauma-informed practice at Humboldt College. And I always say to my students, because they're so dedicated, they're so committed, they're like, oh my gosh, they like try the Professor Perry. And I'm like, no, we're just, Alex is good. But, you know, just what if I ask the wrong question? Or what if I said, as long as you are doing two things, one, we have 2 ears, 1 mouth, listen more than you talk. I'm sure you know that one. Same thing here. Just listening can go so far. And then number 2, just simply ask, like, what can I do to help? What do you need right now? How nice is it when someone asks you, Anthony, what do you need right now? Oh my God. It's the best question. What do you need right now? So good.
Yeah, it's overwhelming too sometimes because I'm like, I don't even know. I don't know. You tell me what I need. But it's the ability when that person asks that question, if they're able to not jump in when you don't know the answer, because I do that too, right? Where if you ask someone for help, you have to pause and you have to be okay with silence because it'll come out. To your point, eventually, it'll come out. right? But when it's, I have to, well, do you want me to do this? Do you want me to do that? It's like, dude, just
I'm like so one of those people.
Yeah.
100%.
Silence is tough. Yeah.
Silence is tough. Yeah, silence is tough. I mean, there could be also a world where, organizations and different companies actually include some people like us on their team.
I've thought about that.
Yeah.
Actually. That's weird that you bring that up.
Yeah.
There's a role for that for sure.
Totally. And I don't think it's like a counselor. I don't think it's something like that, because people just already are like, okay, that's not going to be helpful. No one uses EAPs. It has to be something that's really authentic, and the ability to like really connect with people and understand, and almost like maybe even like a consultant, like just a place where people to be, able to openly talk. Because I noticed too, on the flip side of things, being part of senior leadership, I've never worked in an organization and be like, we're just choosing to be horrible. Like no one's choosing to do things that are not great for their employees.
Mm-hmm.
I've always worked somewhere where their intention is they want to do best by their employees, by their company, and they're managing, again, these like really hard paradoxes that don't work easily together. Having said that, again, those roles need to ask for help, lean into curiosity, and work with experts who can help them identify some things. And they might not be big, they might be small, or they might be big, but I do think there's a world where companies get more involved in this type of conversation with people who have lived experience.
Yeah, a mental health consultant, right?
For the company.
Right,
Isn't that good?
You work at the company.
Yeah.
And instead of HR, right? Like you're a part of HR maybe, but you're the mental health consultant. No one has to know that you saw the guy or girl or person, right? No one has to know.
Yeah.
And it could just be as simple as resources. Yeah. Like, I talk to so many people today that have no idea what RAM clinics are. They have no clue, right? And it's such a helpful resource, right? Rapid access addiction medicine. I've been there myself. I've gone through it. And it's a great program. Like I was able to show up. They gave me resources, all covered under OHIP, right? And that's the biggest, maybe you can talk a little bit to this too. I don't have money. How do I get sober? I need money to get sober.
Yeah.
I hate hearing that.
I know it's brutal. So just the mental health thing, I love what you said about a mental health consultant for the organization someone can lean on. I think even bigger of the mental health of an organization, like the whole system of an organization that was like a person, an entity. How is the mental health of that entity? That's what I think could be really cool. Anyways, you don't have money to go to treatment. Yeah. This is a hard topic to talk about because it is a bit controversial these days with things like involuntary treatment, what seems like a push for privatized healthcare, and many, many organizations and nonprofits who actually do the work that needs to be happening and have for a really, really long time, just like not getting funded properly. Okay. So I think maybe 2-part answer. One is if someone out there is struggling and
I'm looking at you.
Yeah, we're looking at the camera. If this speaks to you, if you're struggling and it feels like you can't afford treatment, I would still call a treatment center. So for the Canadian Addiction Treatment Centres, one of my favorite things about them is they have a referent relations manager role. And that role is really intended to help navigate the different options people have. Because they're usually the ones that work with different, like you said, unions or referents is what we call them. And that could be various different
Insurance
organizations.
companies.
Yeah. It can be a number of different things. So I would still always call. I know it feels really defeating and probably hopeless in some ways, but always call. If you're a person for yourself or you're working with someone as like a social worker or a case manager or something like that, call and then ask questions like, is the person working? Are they a veteran? I mean, there's many people in the shelter system that are veterans, which is not okay. But that can open potentially a direct referral pathway for someone to get access into treatment. There's other ways that people can ask, like partnerships. I work really closely with an organization called Victim Services. They have a treatment pathway for survivors of human trafficking. So again, in this system, like let's say if someone goes to a RAM clinic, to your point, and a caseworker at a RAM clinic notices like, okay, I'm really feeling like this individual is fleeing, a really dangerous situation. If they know about this pathway, they can get the person in at no expense. Like it's a funded pathway for immediate access into treatment. So ask questions, even though it may not always result in a funded option into treatment. Number two, if anyone out there is working with a team or is like myself, a member of a company like CATC, make sure your resources are widely available, because there's so many silos in the system that we can increase people's chances and access to treatment by working together. And then all of a sudden you get to have these wonderful conversations like, there's already established funding here, but why don't we all come together to get more funding and get people more access to treatment? So that's another maybe perspective, but at the end of the day, you've hit it right on the head. This is the biggest challenge right now for recovery and treatment. And it feels like, it might be, again, controversial to say, but it feels like recovery is privilege in a lot of ways, which isn't equitable to people.
I mean, there is a part of that that's true though, right? Like I'm doing the schooling right now for becoming a social worker, and
That's great.
It's recognizing your privilege in a lot of scenarios, right? If I didn't have support, I've been to 3 rehabs, and if I didn't have, I remember when I was 23, my mom calling public funded organization in Toronto. And at that time, I think it was 3 to 4 month wait list. But the other caveat too was I had to be willing and call in. So she had this 23-year-old kid, didn't know what to do with him. I didn't want to stop drinking or using. Right. So
right.
in that scenario, the only option really was to get into a private treatment. And I'm grateful that I had that experience. I don't know what would have happened if it went the other way. Right. Yeah. So there is a part of that where I do have to recognize that there is a privilege, but at the same time, I've met so many people in recovery that have come from absolutely nothing and gotten sober, even without rehab, right? Totally. They've gotten sober with 12-step meetings or smart recovery or whatever the modality is in that scenario. Not everyone needs to go to rehab too, right? I needed to.
I mean, listen, it's something that I think I really believe in as, the most kind of terrible way of saying this, but like bang for your buck. Like you're gonna get the most support in that time, than obviously waiting or doing individual sessions. But either way, the majority of people probably cannot afford treatment. And that's a problem. So if we go back to just the system thinking of it all, there's a lot of ways our system needs to just kind of face the facts that the majority of people don't have access to the supports they need. And to your point, I also really struggle with the fact that our system is like a fail first mentality. People have to suffer. Like one term I would love to hear your thoughts on this, but hitting rock bottom. Do I think that that's necessary for some people? For sure. Do I think that that's what we need to get to before people get access to support? Absolutely not. We are never going to get out of this the opiate crisis, if our mentality is that people have to hit rock bottom. That is people dying. That's not a rock bottom we should be waiting for before action is taken. I get that that's not always what people mean by saying those words, for sure, but there is something that is backwards within our system, you know, and if you think about substance use as a health issue, like a chronic health issue, like we do for cancer or something else, how many preventative measures and resources are there out there to help us prevent that chronic health issue from happening?
Yeah, it's the same thing. I've changed my mind on it, I think. I was very rigid with that before. Like I really did believe that you had to, and again, yeah, I mean, you mentioned it though. It is subjective, right? My
Totally.
rock bottom is not, my trauma is somebody's Tuesday afternoon. I always say that, right? Like my Tuesday afternoon is someone else's trauma, right? And it's really subjective. I have, in comparison, I've been hearing recovery stories for 10 years now. And in comparison, my bottom is very high comparatively, right? I've heard a lot of really rough things going on in people's lives. And I do think that somebody does have to come to a place though, where, there's a piece of recovery literature that mentions incomprehensible, pitiful and incomprehensible demoralization. Like this point of like, oh my God, I'll do whatever it takes. Right. But I do also see how that can be dangerous, right? Because it's very reactive and not proactive.
Exactly.
Right? So I'm just thinking like, what is a more proactive approach? That's my thought with it. And I don't know if I have the answer. I don't know if you have the answer to that, but how can we be more proactive? That?
Well, what comes to mind for me is, and just going off your point about I love your trauma is someone else's Tuesday. I love that. I might steal it.
Steal it.
Credit to you,
I probably
of
stole
course.
it. No, I probably stole it.
But I think that's exactly it, is like how scary it is that if, I'm walking around looking like I'm doing just fine when really Alex is at her rock bottom and no one is seeing that, because I don't feel like I can say it. Like, that's scary to me, Anthony. That's like, to me, that makes exact sense as to why people feel so alone, why they feel so ashamed, why there's so much stigma. So yeah, I think we need to keep having those conversations for sure. And then the system reactivity versus proactive. Yeah, I mean, it's a good question. What comes to mind is really individualizing. I've not always, shouldn't say always and never, but I often hear myself say that we need to invest in people individually. Really, if we could live in a world where, Anthony was looked at as Anthony, and this like all that Anthony is and where he is and what he needs, and design his own system around him, or like resources or treatment plan for him. And then Alex is invested. I'm kind of like looked at as this, an whole person that needs investment into that person. I mean, could a design, I don't know. I'm just like thinking out loud right now, but right now the public sector is, we all pay into it. Everyone gets access to basically the same things. But I mean, I don't know. Is there a world where, here's the funds that you have on an individual basis and use them as needed? And you might need them for one thing and I might need them for something else, but we have access to them. And then, that does start steering us possibly into like maybe what feels like privatized healthcare, which I'm not necessarily a supporter of, but something needs to change. At the end of the day, something needs to change because it's not working. And it's more than not working, it's hurting people.
Yeah. I think, as you're talking there, I think I always think about like what can I do right today? What are the small, because change does happen over small actions, right? In my experience. And I think when it comes to sharing my story and getting on social media and doing this podcast, maybe it opens up somebody earlier in their life saying, hey, I think something's wrong here. I'm not using like John is down the street.
Yeah.
Right? Like everyone's going home at the end of the night and I'm in the corner doing more drugs. I don't like this.
Yeah.
Right. And just the ability. So when I think proactive, like very simply, it's like putting up your hand a little bit earlier, right?
Totally.
Rather
Yeah.
than I'm burning in a fire here, mom or dad or loved one. I think this might be a problem. And then we can intervene and start doing something about it.
Yeah.
Right?
Like we all know ourselves the best. I mean, the world really likes to pull us away from our gut feeling as much as it can, but trust your gut in every sense. And if you feel like you're going down a path where you're starting to notice, like I remember I've never struggled with substances myself, but I remember when I was working in the shelter system, I would respond to so many overdoses and deaths and just things that, we don't need to talk about, but I would get home so late and the only way I could fall asleep was drinking a glass of wine. And I would get up in the morning and that went so quickly from a glass of wine once or twice in a week to like almost a bottle in a night. Like it was, and then I had to stop myself and just say, this is not good. This is over. My body is not doing okay right now. And on many levels, like not even just if we look at as the drinking or substance or addiction as the symptom of what's going on, I was stressed. I was, working probably 90 hours a week. I was being exposed to all of these different things, which many, many people are still currently struggling with and experiencing as frontline staff. And there was just no support. And that was the only way I felt I could, get some sleep and not think about the images I just saw or, just try and get a bit of rest. So, I mean, trust that instinct and that gut, because if you know things are going to be a couple months away, like you shared a treatment center in Toronto said there was going to be a 3 or 4 month wait, let's start getting people ready for that 3 or 4 months, and it doesn't mean that you don't need help just because you can make it that 3 to 4 months, like if anything, that's going to be, it's all going to be more effective for you because you're taking it into your own hands and you're asking for help when you start to feel like the struggle starts, so I agree with you. I think getting that hand up sooner and earlier is great. And, family members, if that's something too, normalize it in your family, have these hard conversations because it's just a reality of the world. The world has changed, Anthony. I don't know how old you are. I'm younger, obviously, but maybe we're around the same age. When we were younger, a lot of the stress that didn't exist, we were having different conversations around the dinner table. We were doing different things as a kid. We've got to really try to keep having those connected conversations so that at that first sign of help, we can be like, okay, we've got to like step in now, as opposed to it just like bubbling it under the surface and then it fucking explodes. Yeah. Oh, well.
Sweep it under the rug.
Yeah.
I was a master of that. I'm just thinking about like vaping is one of those things now where it's like, that's coming into, that wasn't a problem when I was a kid, right? I was born in 92. So I know you're dying to know. So there you go.
I'm not younger than you.
But yeah, it's like my, I grew up in a culture where, and this is no fault of my parents at all, right? I had a very good life growing up, very good. I had everything I needed and wanted. It was easier for me to lie than it was to tell the truth because I was so scared of consequences. And I believe that's not what made me a drug addict. There's no doubt about that.
But it's part of the conditioning.
It was part of the whole thing. And then this whole, my whole life, if you were to draw a corroding thread through anytime I picked up drugs and alcohol and went down the wrong path, it was always not being honest. Like that is like the number one thing. It was secrets, and I'm not telling you, I'm gonna lie about it because I'm scared of the consequences. And then it just becomes like this habitual thing, right? Where you're like, what did you do yesterday? And I'm like, I went out I'll just lie about that because I'm embarrassed or it doesn't even make sense. There's no reason sometimes, and I'll just lie, you know what I mean? So that's something that I struggle with. We don't, trying to think of, I wish we had more time, but we don't. But you'll have to come back or we will have to reconvene in another way, collaboration style.
Absolutely.
Let me ask you this. What What do you hope people get out of your work and your story or message?
I hope that people get a bit of validation and feeling heard and seen. I got you guys. I have a commitment to carrying forward every person I've come across professionally, a client, someone in a shelter system, doesn't matter. Everyone's equal, and your stories matter. And so I hope that feels, validating today. And then from, the work I am doing and going forward want to do is, it's the same thing as when I started as an addictions counselor. I just want to help people. It's in a different capacity now for sure, but I think it's in potentially a capacity that, could really be system changing and might really start to make the world a kinder and better place for people. So not to say I'm going to do all of that myself, but just one conversation at a time, hopefully.
A cog in the wheel, right?
Yeah. Exactly.
Again, it's small things, am I being a kind person today? Am I listening instead of waiting to talk, right?
Yeah.
I love the 2 ears, one mouth.
2 ears. Are you a minion?
Maybe,
are those minions?
Maybe if you go into Lake Ontario too much.
Yeah, seriously.
But,
okay, well, we'll do a part two.
We will have to do a part 2.
Where can people listen to your podcast? Is that what you're supposed to say?
No.
Oh, okay.
They know.
Okay, sorry. Okay.
Are you on social media? Where do we find you?
I'm just a person.
Let's make it about you.
On social media. I don't really have like a big following or anything, but stay tuned. Maybe by part two, I'll have a handle. Is that what they're called?
Yeah.
Whatever. Elder millennial over here.
Is your account on private or public?
Private.
Okay, yeah, that says everything right there.
Yeah. It's definitely private.
I have a private account too. But,
yeah.
Everything's out
private
there.
Person.
So.
Yeah, private person.
Listen, I appreciate the work that you're doing. Seriously, nothing gets done unless we change high level systems.
You got it right there.
We could just keep complaining until we're blue in the face, and nothing changes if we don't do something on top.
Start to have, I'm really excited about this role I'm stepping into next week as someone who brings expertise on substance use. We need more of that in the workplace. And just if anyone out there needs help, ask for help. We got you. You're loved. You're worthy. And proud of you for being courageous to ask for it.
Thanks so much, Alex.
You're welcome.
Amazing. Thank you.
Thanks for listening. Please help us grow the channel and like, share, and subscribe for more content. The discussions and stories shared on this podcast are for informational and motivational purposes only. This content is not a substitute for professional medical advice, addiction treatment, or therapy. If you or someone you know is struggling with addiction, please consult a licensed physician, addiction specialist, or mental health professional. You are no longer alone.